Now, speaking about health equity, what group in the country is the most vulnerable well, I guess more unequitable would be the right word.
I think it's the poor, and they're predominantly African American. It's the undocumented workers, 11 million. All of those are very vulnerable. I think that the Affordable Care Act, through the financing program they are providing, the subsidies, will make a big dent in this.
Now, I mean, when you speak about the African American community and you speak about, the Latino community, I think the biggest problem that you have is this, the stigmatism that exists. And even with the Affordable Care Act, you can pass legislation until the Lord comes. Getting these groups to go to the doctor and getting these groups to actually get health care is quite challenging.
Well, why not? I mean, they've had a terrible experience for the most part. Access has been difficult geographically, financially, uh, culturally. All of those have been barriers to access to care. I think the Affordable Care Act at least provides the opportunity for the healthcare system to change that. There are things in the act that relate to the way that information is presented, to cultural competency, and those are important things if we're really going to make an impact on the people that are most vulnerable.
I love that. If we're going to make an impact, we've sort of got to change the conversation a little bit.
Tremendously. We have to recognize that the system has elements of racism in it, and it doesn't recognize that because it's not explicit. It's kind of implicit in the way most of the people in the system are brought up. And that's a really difficult problem for us to tackle.
Well, hopefully we know that hopefully some of this stuff will get handled this weekend, and we'll continue to see a lot of these nonprofit organizations that are here this week and go back and do the work that requires so much work and so much bustle and oomph and strength.
We're in the city that passes legislation, but these programs don't get implemented here. They get implemented in communities,
You're
grassroots,
completely right.
and that's where this group really shines.
I couldn't have said it better myself. Dr. Kimmey, thank you so much.
You're welcome.